Hello everyone, today we are back with another video on anxiety disorders. So first of all, we have to understand what is anxiety. Anxiety is defined as a distressing, unpleasant emotional state of nervousness and uneasiness. It is diffuse, unpleasant sense of apprehension, nervousness. And anxiety presents with physiological symptoms which include sweating, tachycardia, tremors, restlessness, chest pain, cold clammy skin, headache. Now, whenever you think of the word anxiety, what comes to your mind? That it's some state of nervousness or it is an uneasy state. So, you may remember the definition. It is an unpleasant sense of apprehension or nervousness, and it's an unpleasant emotional state. And it presents with these physiological symptoms. You might have experienced this anxiety while in exams, that you are having sweating or tachycardia, your heart is pounding really hard, tachycardia and tremors, your hands are shaking, restlessness, chest pain. So this is the definition of anxiety. Now let's go to epidemiology. Anxiety is the most common psychiatric disorder worldwide, and for India it's depression. And the most common individual disorder, by individual I mean that among the anxiety disorders, which anxiety disorder is most common? So that is specific phobias. We will be looking at the types later, but you remember that the most common of all these anxiety disorders is specific phobia. Let's see. All the anxiety disorders are more common in females. Now, just like depression is more common in females, you may remember that this anxiety is also more common in females. But the exception is the social anxiety disorder. This is equally present in males and females. This is also seen in males and also in females, and they are both equal. So we will be reading about social anxiety disorders right now. Now first of all, look at the types of anxiety disorder. The first type is the panic disorder, and the second is agoraphobia, third is specific phobia, fourth is social anxiety disorder, and the fifth is general anxiety disorder, which is GAD. Now how to remember it? First of all, whenever you think of anxiety, you must be thinking of that you are panicking or something like that. So panic disorder should come to your mind. And I am telling you here that panic disorder and agoraphobia, these both the conditions coexist very frequently. That agoraphobia is comorbid with panic and panic is comorbid with agoraphobia. So you have to remember these two together, that panic disorder, agoraphobia. Now, once you say this phobia, you have to remember, you just think in your mind what other phobias you have read about. You have read about specific phobias, you have read about social phobias, or which is also called social anxiety disorder. But just say specific phobia, social phobia. You say, you are saying that you are thinking of other phobias, double S. So one will be specific phobia, second will be social phobia. Then general anxiety disorder. The anxiety is coming in its name now. So types of anxiety disorder, you will write this general anxiety disorder. So what are the 5 types? First is the panic disorder. You are panicking. It is more commonly associated with agoraphobia. These two will coexist very frequently. And then there is specific phobia, social phobia, and general anxiety disorder. First of all, let's look at the panic disorder. First of all, what is a panic attack? It is an acute sudden attack of intense anxiety. There is very, very intense anxiety. When you are panicking, there is intense anxiety. The patient will present with fear of impending doom. You are thinking that there is nothing left now, and now you are going to fail the exam, and now this is the end of the world. You are thinking like that. So you must have faced these panic attacks during exams or before the exams. So this is perfectly normal. Now let's look at the panic disorder. Now the problem arises when these attacks are recurrent and they are unexpected. Like before exam, you may expect that you may have a panic attack. But what is a panic disorder? That it's unexpected. It can occur anytime. Like right now you are studying and you may have a panic attack. Right after that, you may be driving your car and going somewhere. Then you are having a panic attack. So you don't know when you will have the panic attack next. And this will last for 20 to 30 minutes. And rarely it lasts more than 1 hour. It will last for 20 to 30 minutes. And usually in between these attacks, you will be normal. The patient is normal. But in some patients, there is anticipatory anxiety. Anticipatory anxiety means that the patient is thinking that he will have another attack, and so he is developing anxiety. Like in anticipation of another attack, he is developing anxiety. So that's anticipatory anxiety. See, I have written here, agoraphobia is a comorbidity of panic disorder. And differential diagnosis. Now see, when the patient will present with these symptoms, you don't have to, you just cannot directly make the diagnosis of anxiety and this panic disorder or anything else. First of all, you have to think about these conditions also. Like he may be having a myocardial infarction, he may be having angina or cardiac arrhythmias or mitral valve collapse, anemia, asthma, and acute asthma attack, COPD, pulmonary embolism. He may be having hyperthyroidism, hypoglycemia, pheochromocytoma, seizure disorder, migraine. So think about these conditions before making the right diagnosis of your anxiety. See, hyperthyroidism, his heart rate will be increased, tachycardia, sweating, and all that features will be present there. Same with the hypoglycemia. What is pheochromocytoma? Now let's see this pheochromocytoma. In pheochromocytoma, this is the tumor of your adrenal glands, the suprarenal glands. In that, the epinephrine and norepinephrine levels will be raised. So that will cause the symptoms. These symptoms again that I've told you in the starting: sweating, tachycardia, tremors, restlessness, chest pain, headache, cold clammy skin, all. Now let's go to the second condition, which is called agoraphobia. Now how to remember it? Now, like first let's see what's this agoraphobia, then I will tell you the trick. So agoraphobia, this is the fear of places from which escape might be difficult. That you are in some place and you are thinking that you can't escape from here, and you are having that fear. So what is agoraphobia? Agoraphobia is the fear or anxiety in two or more of the following situations. Out of these 5 fears, you should have at least two or more. So fear of public transport, fear of closed spaces, example in a lift or elevator, or fear of open spaces like in parks, fear of crowded places, standing in the line, fear going out of home alone. Like the patient will be just homebound. He will be so fearful of going outside the home that he will always stay inside the home. Now how to remember this agoraphobia? See, this gora in Hindi means white, and people are phobic of whites because now you have to just think that the people are phobic of whites. They will run whenever they see them. You know the Britishers have colonized so many countries, so the indigenous people must be very fearful of them. Whenever they see these whites, they run away from them. So agoraphobia, now here it is A. That means these people cannot run from these goras or whites. Now you cannot run from these whites. So you are getting anxiety in those places where you cannot run from these whites. So this is what is agoraphobia. It is fear of places from which escape might be difficult. Now you have some picture in your mind, and you will recall this thing in the exam. So agoraphobia and panic disorder are usually comorbid, that they will exist concurrently and they will be existing frequently together. So now let's go to the specific phobia. What is a specific phobia? It is a strong, persistent and irrational fear of an object or a situation. Irrational means that object or situation is actually not harmful, but the person is perceiving it as very, very harmful. Like acrophobia, it is the fear of heights. Claustrophobia, closed spaces. Hydrophobia, water. Thanatophobia, death. Nyctophobia, it's dark. Pyrophobia, it's fire. Xenophobia, strangers. Mysophobia, germs or dirt. Ailurophobia, it's cats. Cynophobia, it's dogs. Now how to remember this? See, these are simple. That Thanos is the god of death, so you may think Thanatophobia, death. Xenophobia, you must have read in your school that xenogamy is the fertilization between the pollen of a genetically different plant. So it's very different now. So that means it's the fear of strangers. Now mysophobia. See, mysophobia. You say my soap. You wash yourself with soap daily to get rid of germs and dirt. So mysophobia is phobia of germs or dirt. And ailurophobia. You may think that you are just luring a cat, so cats. Cynophobia, cyno, you may think of some canines are dogs, so this. Now let's go to social anxiety disorder or social phobia. This is the fear of social situations, example large gatherings, marriage, etc. And there is fear of embarrassment, that you will embarrass yourself in front of others. In this social situation, you will just embarrass yourself. This is social anxiety disorder. Now let's go to generalized anxiety disorder. This is in generalized anxiety disorder, you are generally having anxiety all the time. So he is saying that it's free floating anxiety, generalized and persistent anxiety, and it does not relate to a specific event or trigger. Even on small things you will have anxiety. So it's just free floating anxiety. You are having anxiety, generalized anxiety all of the time, and the patient will worry excessively. Like even if his children are late just for 10 minutes from coming from the tuition, the parents will the parents who are having this GAD will get excessively worried. And what are the physical symptoms? The palpitation, tremors, headache, restlessness, what I taught you as the definition of anxiety. All these symptoms must be present, only then you will call it anxiety. At least some of them should be present, these physiological symptoms. So let's go down here again. Generalized anxiety, these are the physical symptoms. Now let's go to the treatment part. In treatment for panic disorder, let's see the treatment for panic disorder. The treatment is divided into two. First is the pharmacotherapy and second is the psychotherapy. First of all, we will be looking at pharmacotherapy. In pharmacotherapy, you just remember SSRI and benzodiazepine. SSRI is selective serotonin reuptake inhibitor. I'll be talking about SSRI, SNRI, all these drugs in the next video. So please watch it also. So see, in all these disorders, what drug are you going to give? SSRI, benzodiazepine. Benzodiazepine is very addictive, so you can't give it for a long time. So benzodiazepine will only be used for short term, like if a patient is coming with the attack, like he is having the attack right now. In acute attack, you will be preferring benzodiazepine, but for long term usage, you will give SSRI. And you may also give venlafaxine. This is an SNRI. Now venlafaxine, this venlafaxine is an SNRI. It is a serotonin norepinephrine reuptake inhibitor. So you may also give this. See, SSRI, benzodiazepine, venlafaxine. In agoraphobia also you're giving SSRI, benzodiazepine. You may also give venlafaxine here also. In specific phobia, they are saying SSRI plus minus benzodiazepine. In social phobia, they are saying you may also give beta blockers. See, social phobia was that you are having this anxiety attack when you are present in some social gathering, like in some meeting hall, or in some large gathering, or some marriage. In marriage there are lots of people and you are having social phobia. What is social phobia? That you are fearful that you will embarrass yourself in front of others. So this is social phobia. You may even have a look here. See, this is the fear of embarrassment, that you are going to embarrass yourself in front of others. So for this, they are saying that you give beta blockers. Like if there is some patient who has a very important business meeting just 10 minutes after or just 30 minutes after, so what are you going to do? Because the patient knows that when he goes inside the meeting hall, he's going to have a social phobia. He's social phobic. He will have an anxiety attack, he will have palpitations, he will have tremors, and the meeting is going to go very, very bad. So you just give him some beta blocker, example propranolol, because it is going to mask all those symptoms. It's a beta blocker. He won't have tachycardia, he won't have palpitations. So this is used for performance anxiety. Now then, last is generalized anxiety disorder. You may again give SSRI, benzodiazepine, venlafaxine. Now let's go to psychotherapy. For psychotherapies, now it's visible. So for panic disorder, you are going to prefer CBT, which is cognitive behavioral therapy. And also for generalized anxiety disorder, you are going to prefer CBT. Now first and the last, what is panic disorder? Panic was that there is excessive anxiety. There is excessive anxiety, in panic, that you were panicking a lot. So you are having intense anxiety, and there is fear of impending doom, that everything is, that I am just failing this exam. There's fear of impending doom, there's fear of dying, losing control, going crazy. So this was your panic attack. And what is panic disorder? That you are having recurrent such attacks, and these are very unexpectedly occurring. No fixed time, no fixed schedule, occurring anytime. So this was your panic disorder. So for panic disorder, you are telling the patient to do CBT, which is cognitive behavioral therapy. And what was generalized anxiety disorder? That he is having anxiety all of the time. So here also you are doing CBT. Now for agoraphobia, for specific phobia, for these, you are just removing this cognitive component of CBT. You are just giving behavioral therapy. Now for in behavioral therapy, the systemic desensitization is very good, and it is preferred in agoraphobia and also in specific phobia. That's why I have underlined it. Now see, whatever is underlined in this orange color, that is the treatment of choice, you may say. It's very important in these categories. So you see, the systemic desensitization, it was developed by Joseph Volpe. He was an African scientist, so he developed it. And you see this agoraphobia, and the other, you may also give CBT in agoraphobia again, but behavioral therapy is preferred than CBT. Now let's go for specific phobia. For specific phobia, again behavioral therapy. You know, one systemic desensitization, other are therapeutic graded exposure, in vivo exposure, flooding, implosion, or participant modeling. And for social phobia, you are preferring CBT. I will be talking about them just now. How to remember where to give this CBT and where to give this systemic desensitization. Now here's the trick. First of all, think about this panic disorder. Panic disorder is intense anxiety. Wherever there is some intense symptom, you have to prefer CBT. For generalized anxiety disorder, there is anxiety throughout the day. He is, even in the smallest task, he is having anxiety. So just give CBT. In social phobia, see, the man is a social animal. He cannot live without this society. Everywhere, even every day, at least he has to go somewhere where he will find other people, like in some meeting, or even outside his home, he is seeing so many people in some social gathering, and he is having social phobia. So that's very difficult for him. So you just give CBT. But in agoraphobia or in specific phobia, in agoraphobia, if the person avoids such places where running away from that place is difficult, so he won't have that phobia. In specific phobia, he knows that I have phobia only from cats, only from dogs, or only from heights, so he will just avoid it. Similarly, for agoraphobia, you will avoid those places where you have such phobias. But how will you avoid in social phobia? So see, social phobia can't be avoided, so you just give CBT in that. For agoraphobia and specific phobia, we will be giving behavior therapies. For agoraphobia, you may also give CBT, but behavior therapy is more preferred. Now let's go to the treatment of choice. Treatment of choice for panic disorder is SSRI plus CBT. Treatment of choice for agoraphobia is systemic desensitization, and same for specific phobia. These two are systemic desensitization. Now let's look at what is systemic desensitization. In systemic desensitization, there are 3 steps. Now the first step is to identify the hierarchy of fears. Make a list, make a hierarchy from the least anxiety to the maximum anxiety provoking situations. For example, if there is some cyanophobic individual who has fear of dogs, then the hierarchy can be stated like this. The least anxiety is imagining a dog. You tell the patient, just imagine a dog, he'll have anxiety. Then the second will be, dog is in the same, you tell him that in which building you are sitting, the dog is present in that building, he'll have more anxiety. Then dog is on the same floor, he'll have more anxiety. Then dog is outside his room, dog is inside the room, and dog is near him or her, he will have the maximum anxiety. Now you have made the hierarchy of fears. Now the second step will be to learn, you have to teach the patient relaxation techniques, like if he has anxiety, what he is going to do to relax himself. So that will be relaxation techniques. And the third step will be to go through this hierarchy. Like, first of all, you will just tell him to imagine a dog. Supposedly he doesn't have anxiety this time because he has mastered this. Now when you tell him that the dog is in the same building in which you are sitting, he has anxiety. So you just tell him that what relaxation techniques we have told you, you just do them and he will eventually get relaxed. So he has to master it. And when he masters this second step, he will move to the third step, he'll move to the fourth step, like this. And slowly and gradually he will just master all of these. Now the second will be therapy. Now the second therapy is therapeutic graded exposure or in vivo exposure. This is same as systemic desensitization, but there is no relaxation techniques which are being used. Now third will be flooding or implosion. Now here I have written letting your intrusive thoughts win. Now these scientists and these doctors have let their intrusive thoughts win. Now see, there's some xenophobic individual who just hates dogs and he is just fearful of these dogs. So what you do, you just put him inside a room which is full of dogs. So that will be supramaximum stimulus. He will have intense anxiety and this will gradually reduce. Now this is I would say this is a very bad type of behavioral therapy, like flooding implosion. That's why they are saying this systemic desensitization is the best one. So you just give this in what two conditions? In agoraphobia and specific phobia. And the last is participant modeling. The participant learns by imitation. For example, there is some xenophobic patient, so the therapist makes the dog sit next to her and she is just pampering the dog, and eventually the patient also learns that this dog is not so fearful, and eventually he will not remain xenophobic anymore. So this was all for today, guys. Please don't forget to like, share and subscribe my videos, and do post the comments below this video if you love my work, and what all topics should I cover in my next video. Please let me know in the comment section. Thank you.